Good afternoon. Welcome to this week's Office Field Services and Manufacturing Support Call. We want to thank you for again joining us to ask your questions, get updates, get information you need for yourself and your employees, and to provide us feedback when we ask or whenever. We will be changing the schedule starting next week, and Jesse will go over that later on, but it doesn't mean that we're taking away the sessions. We're still going to have a session for you to continue to get updates and continue to ask questions. So please look for that in the upcoming emails. If you have any questions today, I know I had a couple emailed in, but if you have any questions today, put them in the Q&A or the chat feature, and we'll try to answer as many as we can. At this time, I'm going to hand it over to Jesse Rounds with Boulder County Public Health.
Thanks, Corinne. And I want to apologize in advance. I had to turn my camera off because my connection isn't great right now. But let's dive in. So I'm going to give sort of a relatively, hopefully quick update on the long-term outlook for COVID-19, our public health and mask orders, some resources that are available, and then we will jump into the sector-specific information and Q&A after that. So in terms of where we are now, we are in Safer at Home, the public health order Safer at Home, and we're likely to be there for quite some time or something like it for quite some time. And that is because we don't have a vaccine, we don't have an effective treatment, and we have not reached herd immunity. It will be months, and regardless of what order we're in, we're going to see restrictions continue to protect public health. In terms of an epidemiological update, I really wanted to hammer this week. When you're dealing with an outbreak or you have a sick employee, please follow Boulder County Public Health protocols. Contact us, look at the website. The information is there about how to protect yourself, your employees, and particularly the employee who is sick or at least exhibiting symptoms. And one of the things that the epidemiological team asked me to highlight was that a number of businesses have been requiring employees to get tested after they get through their isolation when they no longer have symptoms. And unfortunately, because of the way the test works, those tests can continue to detect virus in the system, even if it's a dead virus or if it's no longer effective virus. And as a result, you'd be putting yourself and your employee in a situation where the employee cannot return to work as quickly as advised. So it's unnecessary to subject employees who have tested positive, gone through the isolation, are no longer exhibiting symptoms. It's unnecessary to subject them to additional testing. In terms of, again, Safer at Home, we're in the 8th revision of that public health order. It will remain in effect even while Protect Our Neighbors is in effect, and I'll get into that in a little bit in the next slide. I included this note about continuing to see revisions. We don't know if we'll see revisions in the future for Safer at Home, but we'll talk about it in these sessions if we do. And I assume we'll have some small revisions to inconsistencies or errors that have cropped up as people continue to try to operate their businesses under Safer at Home. Protect Our Neighbors is the next public health order phase of the reopening plan. To enter Protect Our Neighbors, communities have to apply to the state and they have to meet specific criteria. At this time, Boulder County does not meet those criteria. They have things like the rate of positive test results and hospitalizations. Those sorts of things go into that question of, is the community ready to move to the next more open phase? Unfortunately, we don't know when our community will qualify. And once we do qualify, it'll be up to the public health department to apply, and they will apply for the whole county. And then there will be some period of time where the state needs to review the application, make sure that we're ready, and then they would approve or ask for more information. And only at that time would we enter protect our neighbors. During this time under Safer at Home and in future phases, I think it's really important to think about the risks versus benefits of the activities that you're choosing to engage in. The way to protect our community is the same as it has been from the very beginning: social distancing, wearing masks, washing your hands, and the activities you participate in sort of go along with that. The more crowded spaces you go into, the more risky, the higher the risk of spreading the disease. So I think it's really important to think about that. And one of the best ways to limit risk is to think about that social distancing question. Going outside is a great way to increase physical distance. And so what are some activities that you can do or that you can move outside? And this really comes, this slide here shows it's one study. It has not been peer reviewed, but I think it backs up what we're hearing from a lot of experts. And I think the stark difference is important, not so much the actual numbers of the study. And that is that activities, being outdoors, it severely reduces the chances of getting COVID-19, contracting COVID-19. And so trying to find ways to move activities, whether they're common activities like having meetings or taking breaks, going to the restaurant, or whether it's special events like using parking lots for drive-in movie theaters, or having your ceremonies in a socially distanced outdoor space. These are ways that you as a business owner, as part of the community, can decrease the chance of transmission. Another way to do that is face coverings. And as I note here, along with social distancing or physical distancing, whatever you want to call it, and hand washing, face coverings are one of the best ways to reduce the chance of transmission. Face coverings worn in public can also set a good example, and they do protect vulnerable populations, which is really important. The county itself does have a face covering order, and it is in place indefinitely. It requires that people wear face coverings indoors, and when they can't maintain 6 feet of physical distance outside. On top of the Boulder County face covering order, there are local ordinances in some municipalities within Boulder County, and I encourage businesses to look those up because those are more restrictive than the Boulder County face covering order, and so you would need to adhere to those as well. For a number of weeks now, we've been promoting this face covering script. It's really, we believe it's a useful tool for helping businesses interact with people who do not want to wear a face mask and still provide services to those individuals. It walks you through a conversation about that. Just a little bit more about face coverings, or I'm going to keep on hammering this, I guess. Goldman Sachs did a study a couple weeks ago. It was mostly just a statistical study, but they looked at the impact of lockdowns, especially renewed lockdowns, on the national GDP, and found that if there were significant lockdowns, there would be a 5% impact to the GDP. And face coverings are a way to avoid those lockdowns. So they looked at more about how the behavior of face coverings, of wearing face coverings and using that either a mandate at the state or national level might reduce the economic impact, and they found that it would have a significant impact. So just again, I think there's a lot of attention being paid to this, and people are finding it more and more an effective tool to avoid some more draconian measures that would have similar impacts in terms of reducing transmission. And now I'm going to go through a couple slides. This came out relatively recently. It is also a paper that just recently came out, hasn't had a lot of attention. There haven't been a lot of these, so take it with a grain of salt. But I think it's a really great way to visualize the effectiveness of various types of face coverings. And so what they did is they created a sort of a lighting situation that showed a cough without a face mask and then with face masks, and showed how far particulate or the material that happens in a cough goes from your mouth in these various situations. And so the first slide shows without a face covering how far the particles from a cough can go in a short period of time. And I also want to note here that these next couple slides, the time frames are very different, but I think the impact is still pretty obvious. In this photo, it's a loose handkerchief, and you can see that in 2 seconds, if you use the scale in the upper right-hand corner, it goes about 1.5 feet in 2 seconds, but is much less, there's just much less in it. And then with a homemade cloth mask, there's barely any of that sneeze escaping the mask at 2 seconds. And then finally, again here, I want to point out that the time frame is a bit different, but with a commercially available mask, commercially made mask, there is much less leakage around the mask, and obviously there's very little escaping the mask out into the air. So with all that, switching away from masks, I just want to get back to a little bit about the information sources that we have available. Our website, boco.org/COVID-19 business, is, we've collected a lot of information. A lot of that points to other information sources, but we do have some locally produced information, access to posters that we produced in partnership with the Chamber. And then covid19.colorado.gov is the state's clearinghouse for information. I definitely recommend, if you have a question and I just want to get a quick answer, that's a great place to go. And with that, I will hand it off to Lalo.
Thank you, Jesse. That's a lot of great information. Thank you for sharing that with our community here. As far as any office updates go, we're still looking at the same regulations that have been in place. There have not been any new updates to the public health order. So for non-critical office-based businesses, that is still Appendix C of the public health order. If you have any questions, please continue everything that's recommended there in the public health order. Just some of the highlights I'll touch over briefly here. We are still at 50% max capacity for in-office employees. Still very important to conduct those temperature checks on your employees before having them come to work, as well as symptom screening, and promote working remotely as much as possible. Just like Jesse said about, trying to promote outdoor, meetings. If you can do that, if you can encourage more outdoor meetings or online meetings to limit in-person interaction, that is preferential. It's important to also have a coordinator, a deputy, I guess it would be a COVID-19 deputy or so for your office space, someone that's really going to take charge in promoting mask use, physical distancing, amongst your employees. If there is if they are coming in through one door, you may want them exiting through a different door, just that we have that entry and exit of employees, and try to keep them separate. So you want to think about a flow of traffic in there in your office space. Personal protective equipment for your employees, really providing that high quality personal protective equipment for your employees will help instill that confidence in your office environment as well. Some complaints that we receive is that the employees feel that they're not receiving the best quality PPE from employers. So you can help your employees by doing that as well. Post your cleaning logs. Again, any kind of high-touch surfaces, printers, doorknobs, light switches, bathrooms, anything like that, you want to be cleaning those on a frequent basis, and post those cleaning logs to instill confidence in your employees as well. Again, we also want to mention that workspaces have to be minimum distance of 6 feet apart as well. And when we're talking about 50% max in-office occupancy, we are talking about office workspace posted occupancy limits only. Additional rooms are not included, like break rooms or conference rooms. So under the Safer at Home and in the Great Vast Outdoors, the 8th Amended Public Health Order, in-person meetings of more than 10 individuals are currently not permitted. So that is to prevent spread of the virus. So please, if you are planning on having a larger meeting than 10 plus people, then you are welcome to do that on an online platform. We had some questions as well about, how do I police, employees if they don't want to wear the mask, or if they, want to meet with more than 10 people. This is kind of a tricky question. The basic rule of thumb here is that you are responsible for your employees as long as they are conducting business on your behalf, and as long as they are in your place of business during normal business hours or on the clock. So you are responsible for them, and the public health order and the mask order are the law, and not following those orders could be considered negligence. So we definitely want to follow those orders to the best of our abilities. If you have any concerns regarding your employees, if they maybe are feeling ill and they think it might be related to allergies instead of COVID, again, we've said this over and over again, best practice is to have your employees stay home. When in doubt, just have them stay home and make sure that everyone is safe. With that, I will pass it along. Thank you very much.
Thank you, Lalo. I'm Ambra, and I am the Field Services Liaison. And I just wanted to give you a couple of updates from last week. So currently the 8th Amendment of the Public Health Order is in place, and that's Appendix B. And new from last week are meeting, showings, appraisals, consultations, open house can occur in accordance with COVID-19 measures in place and indoor event requirements. So, and then from last week, we had a couple of questions on if Boulder County requires a permit or an approval to host an open house, and we did confirm with our attorneys that there's not one required at this time for to host open houses. So just looking at some of the COVID-19 measures, so still gloves and face coverings required for any in-person interactions. Ensure 6 feet or more distancing between all employees, customers, contractors, and visitors. Maintain a detailed log of customer interactions to enable contact tracing. Clean and disinfect all high-touch surfaces between each showing. And then some of the highlights from the indoor event requirements, and that's section IH4 of the 8th Amended Public Health Order, are limit capacity depending on building size, and use the social distancing calculator to note how many people will be able to come into a building or space. And then must create a queue at entrances to ensure a minimum of 6 foot distancing between individuals. And then hold people at entrances that operate in a one in, one out basis when you are at capacity. And then establish a single direction flow of traffic in and out of the building. So if people are coming, in the front door, if there's a back entrance that they could use to come out and around the building, then that would be advisable. And then attendees should refrain from mixing and mingling with other parties while attending the open houses. And then encourage hosts and attendees to stay home if sick or exhibiting COVID-19 symptoms, and then reschedule if necessary. And these can actually be, all be found in COVID-19colorado.gov, safer at home guidance by sector, and then under field services and real estate. Thank you. And with that, I'll turn it back to Jesse.
Thanks, Ambra. I'm filling in for Alexandra Phillips today with the critical business manufacturing update. And I'm going to talk a little bit about critical business versus non-critical manufacturing and how they're continuing to keep those two separate, but there's guidance for both. In terms of critical businesses, workers who interact in close proximity with others must wear face coverings, whether they're medical or non-medical. And the only caveat to that is if doing so would affect the individual's health. Workers with health issues that preclude them from wearing face coverings must document these concerns with their employers. And then there were a lot of questions about gloves early on. And the critical business rules are pretty clear on this, although a little bit oddly worded. Employees must wear gloves as appropriate by industry standards when in contact with customers or goods, if gloves are provided to workers by the employer. So a little bit confusing there, but generally, if gloves are standard practice and they're normally provided, they should be provided for workers. In terms of non-critical manufacturing, this has again been the same for quite some time. Manufacturing can be done at 50% of capacity per room. A room is 4 walls and a door, or up to 50 people, whichever is fewer. It's important that businesses ensure 6 feet of distance between employees unless that makes the work environment unsafe. And then again, require use of masks or face coverings unless doing so would inhibit the employee's health. And all visitors need to be wearing masks unless, again, it would inhibit their health. With that, I'm going to just announce the big change that Corinne mentioned earlier, and that is that next week we are going to one general update session on Wednesdays at 3 p.m. It'll probably be a smaller group of us who are just sort of giving an update on the situation surrounding COVID-19 and the public health order. However, I do want to encourage you, if you have questions, please do listen in. You can ask the questions. If the answer is very specific to your industry, we may take that offline and email you the answer or call you later. We're holding a 4 p.m. session on Wednesdays as a placeholder in case there are either updates that we need to go over for a specific industry, or there continue to be questions about a specific industry that we want to get into in more detail. And we'll announce those in advance so that the people who work in that industry have a chance to sign up and attend. And the Spanish language sessions will continue as well. They'll most often be translations of the general updates, and those should be released on Thursdays after the translation occurs. And links to all those to sign up are available at the link there on the bottom of the slide. And with that, just close out by saying that you please continue to contact us with questions. If you need to report something, please contact us at the number there. That's our call center and the hours for that call center. And with that, happy to take questions.
Great, thank you, Jesse. And we're gonna miss seeing your face today, but I understand with the connection errors and issues that you stay off camera. So we have a couple questions. I had a few emailed in. We'll start with a pretty simple one for you to answer, which is, we're hearing businesses say that people are walking in with a little card with Boulder County Public Health logo that says they're exempt from masks. Do those cards exist, and have you issued those?
No. That's the quick, succinct answer. We have not, and we will not.
All right, so work on this, when someone presents that, go back to the script and say, is there a reason you cannot wear a mask? And then, if they say yes, then go back to that scripting that we've been sending out. All right, so can employers mandate a doctor's note from employees who claim they cannot wear a mask for health reasons?
Paolo or Ambra, do you want to try and answer that, or do you want me to?
I'll just, the public health order does not get specific as far as enforcement on your employees. That's kind of between employer and employee. I was looking it up, and the only thing the public health order says is that both employees and customers must wear at least a cloth face covering or a medical grade mask at all times, except where doing so would inhibit that individual's health, in which case reasonable accommodations should be pursued to maintain the safety and health of all parties, or if the service provided requires removal of the customer's face covering. So that's the guidance that we have regarding the public health order. That it doesn't really talk about as far as enforcement regarding your employees. That may be an HR question that you may want to take up with your human resources department.
Well, in some cases, these are HR people asking these questions, and in which case, we did have a session talking with legal counsel, with employers counsel, and some of those others that talk a little bit about what you can and cannot require. There's certain things about employee privacy, or if you can require testing, and some of those questions that you might want to take up with employers counsel, or check their website. I'm sure they have a frequently asked question at this point about that, and we could send that link as well.
And we can also check with our attorneys to see if there is any, if they've received any guidance from the state on that, and I can send that to you.
I know a bunch of us looked at some of these things beforehand on the
exactly.
state website.
Can't find that stuff.
We know these questions are being asked, but they haven't put them on the FAQs there. So we can also look on some of these other auxiliary services or legal services to see if those FAQs have been put out there. So this leads to the second question about employees and requirements, and that is about travel. So we'll start with, are there any travel restrictions right now preventing people to go to other states and to come back into Colorado?
It's a good question. There are no travel restrictions to or from Colorado at this time, and none at the local level either. The travel is discouraged.
So it still says travel is discouraged. Now this leads to, we've heard of people going to Florida and Arizona and California and Texas, either visiting family or going on vacation. And we all see the news. Those are some hot spots. There's a lot of COVID activity in those states. As an employer, what are some precautions that you can take or should take when an employee returns from another state or one of these hotspot states where it's out of control?
Sure. You can ask that employees quarantine, there are resources available. I believe, Corinne, you said you've linked to them in the past for paid sick leave for these sorts of situations. But I think more important than saying that there are resources or anything like that, it's really important that both employers and employees understand that quarantine is probably the best way to protect your coworkers and your employees alike. Taking that time after you've traveled to areas that have had spikes in cases will have long-term benefits for employees and employers.
We've heard from even people in Boulder County Public Health who have come back from other states. They've noticed that masks aren't being worn in some other states, and they're not following some of the stricter protocols that Colorado's following. So they felt almost like they might have gotten a special gift from another state when they visited, and they have chosen to self-quarantine as well. So there are a lot there. We looked on the state. There's no state resources or requirements here, but you can ask an employee to quarantine, especially if they were in a state that has less restrictions and has a higher levels of COVID. All right, so we actually got a question via email. What are some of the rapid testing resources out there for businesses who would like to either provide tests for employees or have locations that employees can go to for testing?
So there are on our website, there is if you go to the COVID-19 page, which you can find a link at the top, there's a banner, you click on that, there's a link to all of the testing resources in the county, and it will tell you whether you need to have symptoms to get tested, whether you need to have visited a doctor to get those symptoms verified. And I believe it also says if they're rapid testing or not. And so those are your best case scenarios. I know that there are resources available. There are certain providers who are providing businesses with sort of an employee-wide chance to talk, or chance to have a test done at the office, I guess, basically. So your employees could come in, get tested. It would be socially distanced, all that kind of stuff, and you could just test your employees that way.
For example, I can give an example of one of those. Boulder Community Health, is partnered with BioD6 in the area, and they are going in and providing testing to employers. More mass testing for employers. Those aren't rapid tests. UC Health is also offering the same. They're similar links to what Jesse said, but UC Health out of the Longmont area is also providing employer testing opportunities, and in some cases, some of those tests may be rapid, but it depends on getting it scheduled, because right now, scheduling, you have to get it scheduled. Okay, so if you're asking an employee who traveled to a hotspot to quarantine, what's the best practice for number of days to quarantine? Is it still 14?
Yes.
And then if the
Sorry,
person
that was a
gets,
quick answer. Yes.
is it 14? 14 days is the quick answer. Could that employee also get a COVID test to also verify, exposure, whether they have COVID?
The reason that you'd want to go with the with the quarantine first is that you don't know when during their time they were exposed. There's an incubation period possibly, and so that 14-day period really gets to cover the chance that, say they got it on the last day that they were abroad or out of state, and then they tested the day they got back, it wouldn't necessarily show up as a positive test. So that 14-day period really does provide that cushion to make sure that they are not ill. So I don't recommend getting tested as an alternative.
Okay. So a little bit about how the numbers work. So we've seen, we saw a spike in Boulder County, a slight spike after, the Memorial Day, and then after some of the protests that happened and some parties, there was a little bit of fear and some questions about July 4th that came up around July 4th. When will we know if we're going to have a spike post July 4th, if people got together and had parties and so forth?
I'm not an epidemiologist, and I'm not comfortable saying exactly how many days, but there is a delay. I know that when we first started talking about this back even a couple weeks ago, around the time that that big spike happened, people said there's anywhere up to a 2-week delay. That's part of the reason that the way the public health order worked the way it did was the governor would make a change, the state would promulgate a change in the public health order, and then there would be a 2-week waiting period to see what effect that had on COVID-19 cases. So I would expect that somewhere in the neighborhood of 2 weeks after the 4th, we'd know if there were increased cases because of the 4th.
Okay. So it's hot out, you know, and I experienced this yesterday. So I went in the office, had people come in, you know, 2 people, and I had to take their temperature, and it read higher, in the 99s, because they had just come in from outside. What are some best practices in temperature taking, and what is that number, that magic number where you need to, you know, not admit the person into the facility?
Amber, Lalo, do either of you want to jump on that, or do you want me to answer it?
I did hear the number. Let me verify. Do you know what it is, Amber, off the top of your head?
No, I don't
It's,
have a number offhand.
The number is 104.
No,
Sorry,
100.4.
101.4. 101.4. Sorry.
100.4.
104, you'd be in a lot of trouble. 101.4. In terms of best practices, they vary depending on the situation you're in. If you can have people wait in their cars, if their cars have air conditioning, that's one way that they can lower their temperature before getting checked. However, if they walk to work, that's really not an option. If there's a way they can stand in a shaded area for a little bit to lower their temperature, that's another way to do it. I do not recommend allowing them into sort of a vestibule area, because then you're just creating this, everybody standing around waiting to go in. But I've definitely seen this issue in various places I've been, where people are reading high temperatures because they've been standing in the sun waiting, whatever. So definitely, if you can create a shaded space for people to wait before their temperature is checked, that's a best practice.
You know, and so in my case, person read 99.1. So I said, you know, can we just wait a minute or two? I know it's not the 100.4, but let's just wait a minute or two, let you cool off. And they brought it back down to 97.4. So, you know, in some cases, you just want to know that number. It's 100.4, and then not allow them in and let them cool off and retake their temperature. Again, making sure you're social distance, you clean that thermometer and so forth. But I know that question came up yesterday, just with one of my coworkers who's like, oh, what do I do? Let's see, do we have any other questions out there? We've tried. We're gonna see, and I've taken the name of the individual who asked about the employee note, and let me see if I can do some research as well, and we'll send that out. If there's no more questions, Jesse, will you go back to the new schedule slide?
Yes.
Thank you. As a reminder, we're moving to Wednesdays at 3 p.m. So we are combining the industries, which doesn't mean this isn't applicable to you. You're still going to get the public health updates. You're still going to be able to ask your questions, and you're still going to hear where our community stands as far as COVID goes. We encourage you to continue to participate. If there are industry-specific questions, as Jesse said, or there's you know, a concern, or we're seeing some issues that arrive within the industries, we'll schedule a special session with that industry. But right now, with lack of updates, we want to provide this opportunity for you to know what's going on in our community, ask these questions, and get the updates you need for yourself and your employees. So don't shy away just because it doesn't say office industry or doesn't say manufacturing. So please attend on those Wednesdays at 3. We'll record those as well, and then also provide a Spanish one. If you have any requests for, you know, some work groups or special sessions or things you'd like to discuss, please send those to me. We are looking at another option, which is a work group option for some industries, to discuss between you what are some best practices, what are the things you're facing. So please reach out to me about those, and those will be separate and scheduled separately. Since there are no more questions, I will thank our guests today from Boulder County Public Health. Thank you for continuing to provide this service to our community and to our businesses. And I know you get hundreds of emails between the sessions. So thank you for continuing to keep people updated and safe. And we'll see everybody next week on Wednesday at 3 o'clock. And I will send out an email with that new link so you can register for those because it is a new Zoom login. Thank you.
Awesome. Thank
Thanks,
you, Corinne.
Corinne.
Thank you, Corinne.
Thanks, Amber and Lalo.
Thanks.